Hello, HHT community, and welcome to our latest online education session. As you hopefully know by now, June, it's HHT Awareness Month, and Global HHT Awareness Day was just yesterday. In preparation of both the day and the month, we polled our community several weeks back about what webinar topic would be most meaningful to you. And mental health and HHT was the runaway winner. We greatly appreciate Dr. Abbey Hughes' time and expertise tonight to help us host this session. As for me, my name is Riley Blevins. I'm the Senior Director of Community Engagement here at Cure HHT, and I will be moderating tonight's session. Before we jump in and get the program underway, I did first want to make you aware of some important news and announcements. As I mentioned, June is HHT Awareness Month, which is an important fundraising period here for us at Cure HHT. But look, June in this fundraiser, it's not just about a number. This is about lives. This is about ending suffering from HHT. At Cure HHT, our goal and our hope is to deliver a future where therapies, not surgeries, treat the chronic aspects of this disease. That future might be closer than you realize, and our goal is to bring it forward as fast as possible. And every donation helps us do just that. And in June, the impact of every dollar given is doubled. Pleased to share that a generous group of donors will be matching every dollar up to the first $100,000 we raise this June. And transparently, we're still fairly far away from hitting that goal. Plenty of match dollars remain, and let's not let them go to waste. Please visit curehht.org to support our mission today and find out all the ways beyond just donating you can get involved with raising awareness for HHT this June and all year long, for that matter. The next update I want to make you aware of is HHT Connect, first ever global HHT patient registry. Our goal here, it's simple, is to collect health information from as many HHT patients as possible so that researchers and doctors can discover patterns and clues that can help them better understand HHT and develop new treatments over time. By answering a handful of simple questions, you can advance HHT research and do so all from the comfort of your own home. I would strongly encourage every patient here to visit our website, learn more, and consider signing up. Next, our webinar today is brought to you by Bleed Cease. Stop bleeding fast and easy. Later, I will put a link in the chat to receive a free sample pack of Bleed Cease. We thank Bleed Cease for their generous support and partnership to help make events like today's webinar possible. Finally, before we get underway, I did want to go over some quick housekeeping rules for the webinar to make this event as interactive and successful as possible for everyone watching live. If you have a question for our presenter this evening, please type it into the Q&A box to the right of your screen. We recommend that you keep your questions general in nature so they benefit everyone. I will ask as many questions as time allows. And with that, let's get going. It's my pleasure to introduce tonight's speaker, Dr. Abbey J. Hughes. Dr. Hughes is an associate professor of physical medicine and rehabilitation at Johns Hopkins Hospital. She's a clinical psychologist with an expertise in rehabilitation psychology and multiple sclerosis rehabilitation. Dr. Hughes, again, thank you so much for being with us tonight and volunteering your time. And with that, I'll pass things over to you, and let's get this session underway. If you'd like to unmute yourself and turn your camera on.
Thanks so much, Riley, and thank you for those who can make it today and this evening. For those in the chat, if you do have questions, please feel free to put them in and we can try to address them as we go, or we'll also have plenty of time at the end as well. So again, thank you to Cure HHT for having me today, and also wanted to give special recognition to Dr. Sarah Palmer, a psychologist, a rehab psychologist here in our department, who's been a strong advocate for HHT and education around mental health and living well with HHT. I'll be referring to her book and some of the resources as well as we go through this presentation. So these slides, I believe, will also be made available as part of this recording this evening. As Riley mentioned, I'm an associate professor at Johns Hopkins. I'm what's called a rehabilitation psychologist. There are different types of psychologists. Some in the group, others in the audience may have experience working with different types of psychologists. And there are that are health psychologists and rehab psychologists who specialize in working with people with chronic health conditions. We'll go through why that area of expertise and that experience may be particularly helpful to you and to loved ones who live with someone with HHT, or if you yourself live with HHT. So in today's talk, we will go over some of the common HHT stressors. This will probably not be much of a surprise to most of those in the audience. And when we think of the overall picture of mental health and living with this condition, it's important to break down what are the different stressors that you may or may not be aware of that you're facing in day-to-day life, and what impact they may have on you in your individual situation. Not everything about managing this disease is inherently stressful. Some of the stressors are part of the disease, and how we respond and cope with them can also make a difference in how well you're living with the condition and your overall quality of life. We'll talk about the emotional impact of HHT stress, some strategies for managing the stress that comes with the condition, and as I mentioned before, we'll have some time for Q&A at the end as well. So some of the stressors that come with living with this condition. One of the most impactful aspects of this is the chronicity. So from the point of diagnosis, we know that this disease and condition is often unpredictable, and it is associated with a lot of variability. What it looks like for you on a given day may look very different from week to week, month to month, maybe season to season. And that unpredictability can create its own source of stress. The symptoms themselves can be disruptive to daily living. Additionally, knowing a family history status can also be a factor if you are currently planning to expand one's family. If you yourself have a family history and you may be caring for other loved ones in your family with the condition. Access to testing and treatment. We know medical care and access to insurance, it can be a very expensive and uncertain endeavor. And depending on where you are in the diagnostic process and the workup, that adds another layer of uncertainty and stress at times throughout the lifespan. Future planning is, of course, also another stressor to hit within this. So again, for folks on the call and for others who are listening at home, knowing where you are in your own journey, what stressors you're facing this week or this month, and then what coping skills may be most helpful at this time is one of the things we'll talk about today. In terms of the diagnosis, just to recap some of the details within this, we know that some of the diagnostic criteria, right, themselves can be stressful to manage. So the recurrent spontaneous nosebleeds, for example, from mild to severe, some of the unpredictability of when those may occur and the severity of them introduces a level of stress or uncertainty. The telangiectasias and AVMs, or arteriovenous malformations, other aspects of this condition, also layer in some of that uncertainty of how you're managing. And if you're pursuing different medical interventions, again, I'm a psychologist, so I don't specialize in the medical treatment or pharmacological treatments of this condition, but you may be exploring different avenues of intervention for management, and that may come with its own monitoring period of how well you're responding to that particular treatment. And then, as I mentioned before, the family history part, having a first-degree relative, and to what degree does that in your family dynamic play into the coping with this condition? We know that this is a chronic condition, it's lifelong, and while there's no cure yet, that's also one of the main goals of this organization, is to work toward that cure and improve management of the condition. While that is happening, many of you are also facing that unpredictability, both in the type and the severity of your symptoms, how that may wax and wane over time, and knowing that each person is different. So oftentimes when I'm in these settings and folks are sharing different resources with one another, that can be a wonderful way to share resources, share ideas, and also know that you in your own circumstance, in your own context, may respond differently to that. So we have an evidence base for what is generally considered helpful for large groups of people. That's the research driving of trying to maximize treatment for the most people as possible, and knowing that there's individual differences in that as well. There are some disruptive symptoms to living with HHT. I mentioned the nosebleeds is one part of that. There's also significant fatigue and sometimes experiences of shortness of breath. The fatigue and the shortness of breath can have a direct impact from a mental health standpoint. When you're thinking about the goals that you have in your weekly plans, your plans with family, how much you want to get done, chores, the have tos and the want tos, navigating the fatigue component of that can also play into the mental health part when it comes to potential symptoms of depression or anxiety in managing the fatigue. The shortness of breath symptoms can also exacerbate some mental health symptoms. When we're not getting enough air, that creates an inherent experience of anxiety. And when we feel anxious, sometimes our breath gets more shallow, and that can then exacerbate some of the shortness of breath that may also be happening with HHT in the background. So the interplay of shortness of breath and anxiety within this condition, they can go hand in hand and feed into one another. Other stressors include the complications with stroke, potential brain abscess, risks of hemorrhage, the things that you navigate likely with these risk factors on a day-to-day life. And I won't go through the full list here, but we know that at any given moment, you may have some of these risk factors in the back of your mind that also contribute to your overall mental health and well-being. And then finally, your family HHT status. Sometimes people choose to know their status, others choose to not know their status, and that's a very personal decision. Navigating whether you choose to get tested versus not, whether you have access to testing resources versus not, and then going through the diagnostic process. These are all different factors to consider in your individual situation, that if you have many different things going on in life and this added layer is occupying your time, your energy, and your resources, it would make sense if you're having a low time or if you're feeling more anxious as you're going through that decision-making process for yourself and for your family. As we mentioned, access to treatment and access to testing. Sometimes finding an expert can be difficult, and that's why, fortunately, there are the HHT Centers of Excellence to help navigate finding medical care, finding mental health care, finding the testing that you need for your situation. And then finally, future planning. So these different buckets of potential causes of stress. And there's many causes of stress in life in general. There's causes of stress in living with HHT. And sometimes those stressors contribute to mental health difficulties and sometimes not. The result of that sometimes depends on what resources you have and the skills that you use to cope with those stressors. When we think of the emotional impact of HHT, we can think of this as adjustment points across the lifespan. And this may apply to a number of different chronic health conditions. I work in a rehab department where we see folks with a wide range of different conditions, some genetic, some acquired. And there's different points along the lifespan that can affect our emotional well-being. When we think of our emotional health, there's direct effects on the brain that HHT can cause. There's some pretty common and valid emotional reactions to those experiences. So not all of this is indicative of something wrong happening in your brain or responding in a way that is out of the norm. Many of the emotional reactions that we'll talk about are pretty understandable given the circumstances. And so when we talk about feelings of sadness or feelings of grief today, I'd also want to come back to this also being a pretty normative response to coping with a stressor. And if that sadness and if that anxiety or worry starts to interfere with daily functioning, then we can start to think about whether working with a psychologist or a mental health provider may be helpful for that. We'll talk about who's affected, some approaches to self-assessment, and then some common ways that you may approach coping, many of which you may have already tried or navigated. So hopefully coming out of today, you might have one or two new pieces of information or one or two goals for yourself that you could set to improve your overall well-being or potentially address the mental health concerns if you are experiencing those. When we think about adjustment points across the lifespan, we're fortunate for most of us to live long lives. And at different points along that diagnosis, thanks to medical advances, we can manage this condition. And that means that there may be more stressors that come at different phases of life. So one of the initial stressors is at the initial diagnosis point, right? All of the stressors of getting the diagnosis, learning there's this surge of information that comes in right at the point of diagnosis often, and in trying to catch up with that information. And then staying up to date on potentially the new research advances and around treatment. If you experience a sudden change in your status, for example, maybe a sudden hospitalization or a need for a new procedure, that can be another pivot point across the lifespan. That can be another stressor that impacts your emotional well-being as part of that. Then there's some chronic changes in overall acquired disability that can happen over time, especially if you experience other types of chronic health complications. Unfortunately, HHT doesn't happen in a vacuum. Risk of HHT comes with risks of other conditions as well. And so you may be facing some complications with that, and you're navigating multiple components to it. Another consideration in managing this is telling or disclosing diagnoses to family, friends, or people in your school or work. Deciding when, how, if to share that information also comes with its own navigating of mental health concerns. How does this play into your own sense of identity? How might this play in your trust with others if you choose to disclose or not disclose? And then we can think of major life events that are not specific to HHT. However, considerations of HHT may be at play. So things like graduations, getting a new job, going through retirement, all of these may raise questions around things like healthcare benefits. How does one manage HHT in a new job under a certain structure? Navigating transportation to and from work, for example. Pregnancy and family planning, another major life event that is stressful under any circumstances and when navigating a chronic health condition. And then sickness or death of a family member, whether due to a condition like HHT or something more sudden. HHT unfortunately does not protect us from all of the slings and arrows of other life stressors. And so when those things come together, sometimes that's when the mental health component becomes most prominent and needs the most addressing. At the biologic level or at the physiologic level, HHT can affect the brain. We know that there's increased risk of things like stroke and brain abscesses. Symptoms such as headache, risk of seizures, anemia, and low blood oxygen, these can all affect how our brain works. So the degree to which our attention and our thinking can be affected, particularly during an exacerbation, or if HHT is not being optimally managed. Now, some of these concerns are temporary and are reversible, and others can be more permanent. And navigating that part of the uncertainty can be part of that emotional stress that comes with it. We also know that there's common emotional reactions that may be related or completely unrelated to HHT that are, I must say, common, normal, and valid. Right? So when a diagnosis occurs, or when a setback happens, or when there's another medical complication, it's pretty normal and understandable to have the full range of emotions in this, right? There may be some anger, there may be some confusion, uncertainty and worry, maybe some grief and sadness if there's been some loss of function, maybe some fear of what may happen next. On the flip side of that, there may also be experiences of positive emotions, such as gratitude, feeling relief, depending on if you've had a positive experience in the medical environment, support from your medical team or support from your family during a period of immense stress. So while emotions are not inherently negative, right, we experience the full scope of emotion pretty validly and realistically in response to some of the HHT complications. Where it becomes more difficult in daily life is if those emotional experiences are starting to interfere with daily function. That can lead to more clinical diagnoses of depression or anxiety, even withdrawal from meaningful life activities. If you found that you've dropped a lot of your activities due to medical complications or risk factors, that loss of social engagement or that loss of activity can also then further promote the experience of depression, or sometimes anxiety itself, fear of having a fall, for example, may also lead to withdrawal from those activities. In addition to that, sometimes the life-threatening HHT events can also sometimes increase risk factors for conditions like acute stress disorder or post-traumatic stress disorder. Now, just because someone has one of those life-threatening events does not mean that they will automatically go on to experience acute stress disorder or PTSD. I think that's really important to note too, that many people experience traumatic events throughout their life, and it doesn't necessarily lead to that interference in daily function. It's certainly a difficult experience. It's certainly one that no one would ask for themselves to go through. And then the recovery process may look different depending on what other stressors are happening at that time. So it is good to check in with yourself, see how you're feeling, noticing if there's any of those concerns of risk factors coming up, especially if you have had a more traumatic event or a really difficult hospitalization experience. We see that there's also impact on social networks. And we live in a society that is not always accessible and not consistently accessible to people with chronic health conditions who may have mobility considerations or transportation barriers. And the impact of those social networks can be pretty significant. We saw during the COVID pandemic, the social isolation was significant, particularly for anyone with increased health risk factors. So for many people, while we are now 5 years after the onset of COVID, for many people, the behaviors and the fears around becoming ill, having a compromised immune system, or having medical events around that is still very prominent in folks' minds. So seeing how that is affecting you, your social networks within your extended family, with your friends, all something to consider as you're considering potentially maybe seeking mental health support or bringing more awareness to your own mental health status. One way to potentially check in with yourself is to do a brief screening. This is a common screener that's used in many medical settings, so you may already be familiar with these questions. But as a self-check for general symptoms of depression, considering that over the past 2 weeks, asking yourself, how often have you been bothered by any of the following symptoms? And you don't need to respond to these today. We're not screening anyone that is at home or participating in this chat. But something to keep in mind that if you are experiencing some of these symptoms and it's happening more than half the days or nearly every day, that's definitely something to bring to your primary care doctor, maybe your HHT provider. And if you're already connected with a mental health provider, certainly let them know. Let them know if these symptoms are getting worse. So that may include, on the depression side of things, loss of interest or pleasure in things that you enjoy. So not necessarily that you can't do them, but the loss of interest is a big part of that. And then feelings of feeling down, depressed, or hopeless. That hopelessness is a big part of this, that having hope is a really important part of coping with any kind of chronic condition. And that loss of hope can be modified. It can be helped through types of psychological interventions. If you're feeling nervous, anxious, or on edge pretty persistently, irritability can be another part of this as well. Sometimes anxiety presents as irritability for some and others, even if it's not an overt worry. And then not being able to stop or control anxiety or worry. Again, if you're experiencing some of these, it's happening more days than not, and it's interfering with your functioning, definitely reach out to your PCP or your healthcare provider, because there are treatments and there are providers who work with folks like folks with HHT who may be experiencing some of that uncertainty. So now when we shift to thinking about coping, we all cope as humans in different ways. There are some helpful ways of coping, and there are some not so helpful ways of coping. So coping is this big bucket of how do we respond when we experience a stressor. We can think of them in different categories. So sometimes our coping may be action focused, like problem solving or planning. So in the case of nosebleeds, for example, if we're thinking, if you know that you're at risk for nosebleeds in some circumstances, maybe some climates, some activities more than others, you may become more prepared for managing what those nosebleeds may look like for you. If you know that fatigue is a common occurrence for you, you may look to plan your day to try to maximize your activity when you feel least fatigue and break up your day and pace yourself so that you can manage that fatigue. Another type of coping that's generally considered more helpful in the green here is acceptance-based coping. Now, I want to say here that acceptance is not resignation. It's not waving the white flag and surrendering to the condition. And importantly, it is not giving up. When we talk about acceptance in psychology, we talk about it as being a very approach-oriented dynamic, meaning I don't like my situation and I'm going to accept where I am right now because there may be some way to work with this condition differently if I can accept it, right? If I'm not accepting it, then it removes some of those options off the table. So acceptance can mean changing some perspective, and it can mean at times benefit finding. Working with a psychologist or a mental health provider can help us move if we're feeling particularly like, I'm not accepting this, I'm not in a place where that feels right now. And that may be where you are, and that is okay. Sometimes working with a psychologist can say, here's where I am right now. Here's where I'd like to be in 6 months, even though I don't feel that way right now. How can we get there, right? What are some effective strategies for getting there? Some of the less effective ways of coping are the more emotion-focused, meaning venting, and then avoidance. So emotion-focused coping can feel really good in the moment. Sometimes this can be a really helpful short-term coping strategy when we're stressed, when we're angry, when we're expressing that emotion and we just want to get it all out and vent. It can feel so cathartic and can be really helpful in the short term. If we do that a lot consistently without some of these other planning or action-based coping strategies, we lose the opportunity to change our situation, right? Or to get some additional support. So it can become more like Groundhog's Day if we get too much into the venting. Again, really, it can be really feeling good in the moment. And it's that balance of balancing the short-term things that help and the more long-term things. Avoidance is one of the less helpful ways of coping, and we all do it, right? Every human being at times is going to avoid in different ways. When we're stressed, when we're anxious, we may say, you know what, that's going to be tomorrow's problem, or that can come up in the form of denial, maybe disengaging from activities, avoiding something that causes pain, avoiding something that's causing fatigue, maybe use of substances like alcohol or cannabis or other substances that disengage us from the present moment. And again, sometimes helpful in the short term, but doesn't necessarily promote the coping in the long term. So some helpful ways of coping, these are some of those approach, right? If we think of avoidance as a less helpful strategy, approach-oriented coping is sometimes a more helpful way. So learning about HHT, just by you all being here today to learn more about mental health, to validate the fact that mental health is important when managing a chronic health condition, learning about the condition and how it affects you individually, all great ways of helping you cope, because with information, sometimes you can do more with that information. Planning for symptoms, getting and staying physically active, right, while managing the fatigue and having that balance, getting and staying socially engaged, noticing if you are having some of those unhelpful thoughts. Sometimes we call them catastrophic thoughts, and opportunities to explore what are some alternative thoughts for that situation. Even if we can't change the situation, sometimes we can slightly modify the way that we're thinking or viewing the situation, and that helps us feel better, which then helps us engage more in some of those more approach-oriented coping strategies. Seeing a counselor or mental health provider. And then benefit finding. So finding benefits and advantages even in the bleakest or most challenging of situations. And that's not to say that living with this condition is not challenging and doesn't bring a lot of negative emotions at times. This is not to say to ignore and just think positive. That is a drastic oversimplification and also ignores the very human experiences of the full range of emotions that this condition can elicit. But the benefit finding can give us an opportunity to shift that perspective even in the moment of, have we maybe developed closer, more intimate relationships with people because of what you choose to share about your condition or some of those challenges. There may be some bonding and some intimacy that's developed as a result of that. So when we think of the relationship between the stressors, all of these different stressors we've talked about with HHT, and poor emotional health, it's not a direct path, meaning just because you're under stress or just because you experience that stress does not inherently mean that you are going to have poor emotional health. There's usually a middle person or a middle task or a middle step along the way. And research shows that through what we call mediation analyses, or looking at what are the middle things that are happening between point A and point C, what are some of those point Bs? Disengagement can be one of those. So how we cope can help determine how much that stressor is going to then lead to the poor emotional health. And trying to find for you, what is your part B, right? Where is your middle point that you may have some efficacy to change part of it to reduce the likelihood of that poor emotional health piece happening. You may not get rid of it completely, right? We're talking about behavior changes that can create some minor shifts in perspectives that then overall improve emotional well-being, but doesn't take away the fact that you experience these stressors to begin with. In terms of management strategies, we can also think of these in different approaches. So there are many different self-management techniques for managing HHT-related stress and managing your mental well-being. It does not require meeting with a psychologist or mental health provider every day for the rest of your life. And in fact, I recommend not doing that. A lot of this comes through self-management of learning what works for you, sometimes getting some consultation and partnering with a professional for that, and then continuing to be independent and self-manage a lot of this. This may also go for other chronic conditions you may have, like chronic pain or chronic fatigue. Building and garnering your social support system and your healthcare team, that you are at the center of that healthcare team, being your own advocate and advocating for different providers, depending on where you are in your condition and in your lifespan. I also mentioned here finding a rehabilitation or a health psychologist, and I'll provide some links later on how to do that specifically. Within self-management, we've talked about learning about HHT, and that's why you're all here, and most likely you've learned already quite a bit about it. Monitoring your emotional symptoms, like asking yourself those questions that I showed on an earlier slide. Communicating directly and honestly about what's helpful and not helpful for you. It is so refreshing as a mental health provider and psychologist when working with someone saying, this isn't working for me. Okay, let's explore why and what may be a more effective approach, right? As opposed to trying the same thing that you have low confidence in that would work for you. Exploring your HHT identity may be part of this. Setting some SMART goals, and we'll talk about what SMART goals are. And as I mentioned, the finding benefits. Resources for HHT, again, as we've reported, and as will be on the website later, the Centers of Excellence, participating in research can also be a way of learning more about and contributing to that knowledge. And scientific articles, certainly there can be an oversimplification at times of research findings from different third-party sources. So going directly to the scientific articles or other reputable sources for the summary of the scientific outcomes, and resources like Cure HHT are likely providing that reputable information of the most up-to-date scientific findings as well. With self-management, we can monitor emotional symptoms, checking in with ourselves, asking those closest to us if they've noticed a change. Sometimes our partners, our family members, our friends, they may notice a change in us before we do, or before we're willing to admit that there's been a change. And having that trusting relationship to check in with someone is very helpful. You may want to consider the role of fatigue and other HHT symptoms in your emotional well-being and health, right? To what degree does your sleep, pain, fatigue all play a role in that management? As I mentioned, communicating directly and honestly, identifying what your primary goals and outcomes are that you'd like to achieve. There's at times where we may sacrifice our own goals, our own outcomes for a variety of reasons. And over time, that can build resentment, or it can build more fatigue over time as well. So things like using I statements, expressing empathy for others' feelings and perspectives, navigating those difficult conversations, right, that even without HHT can be challenging at times as we go through life. We add HHT to the perspective, and that need for clear communication becomes even more prominent and needed. You can also explore your own identity with HHT. So HHT it is part of your identity, but to what degree, how much of who you think of yourself as you think about your daily activities, as you think about who you are and what makes you you, this may be a very small part of how you think about your daily life, or it could be a very large part or anywhere in between. Knowing that you can make room for HHT and management of it allows you to more fully participate in other aspects of your identity. So it does not have to be all consuming, especially if you're creating space for it to begin with. Setting SMART goals. So I can't see faces of participants tonight, but thinking of if you've ever set any kind of health or wellness goal for yourself, we often, when we feel ready to do it, we want to go big, right? We want to make a big change, and it can feel overwhelming of where to start. So SMART goals is a framework that allows us to set specific, measurable, achievable, realistic, and time-based goals. So for example, if you have a goal of increasing, if you have a goal of managing your fatigue, right, you may set a goal of, I'm going to take 3 15-minute breaks throughout the day to manage my fatigue during work, right? So it's something that is specific. You can measure whether or not it happened, right? Whether or not you took those breaks, whether it's achievable for you. So for some people, taking 3 breaks is not something that's realistic for them, or relevant to them. Time-based is something that you can measure that's within a time frame, so that we're not thinking in the next 5 years I'm going to do X. The closer that we can manage it, the more likely we are to be successful in achieving those goals. Or for example, I'm going to contact my HR office next Monday to inquire about short-term and long-term disability options. Right? Things that we may want to do, but setting a specific goal around it can help us be more effective. The other important part about SMART goals is that it helps us prevent emotional burnout. That when we set goals to be too large or non-specific, we can have a tendency to feel more like failure, or get geared toward that, especially if you also experience depression. So SMART goals are a way of preventing some of that emotional burnout. It involves planning and anticipating some support needs, which has its own work component to it. And that work in the short term for planning helps save some of the distress in the long term. SMART goals also help us use healthier coping strategies for active or acceptance-based strategies. They may be focused on adjusting lifestyle barriers. So things like exercise, smoking cessation, nutrition, all things that what's good for the heart is good for the brain. And what's good for the brain may also help us manage these chronic conditions more readily. And then we talk about benefit finding. So opportunities for connection, gratitude, and knowing what your learning strengths are. Within your support system, it's also important to find and help develop listeners in your community, not fixers, or not just fixers. I don't know if anyone, again, you can raise your hand to yourself if you're someone that when you see a problem, you want to fix it, or if you see a family member who has a problem, you want to fix it. We're human beings. When we see problems, we want to be proactive. We want to work towards solutions. Many of us are drawn to that approach. And unfortunately, the way that this can present at times is it can be invalidating or oversimplifying. So if you've ever had that experience of someone saying, can't you just blank, right? Like, can't you just take a nap, or can't you just see your doctor and get this taken care of? Or why don't you just, that word just, right? It can create a visceral reaction at times. And so the listeners in your life who can hear, who can listen without necessarily offering an immediate solution, that can be a really effective part of the social support. I have that can't you just labeled in red, since that's one that tends to elicit a strong response at times. The one in the yellow here of, well, try this, it worked for me, or here, I'll do X. Again, all of these things are well-meaning people trying to help, and sometimes it doesn't land as effectively. So a validating statement of, this sounds so hard, what would you like from me? Right? Asking an open-ended question, starting with what may be most helpful to that person. And whether you're someone living with HHT, or a partner or a friend or family member who is living with someone with HHT, and you're wanting to be helpful, thinking of that validation part first. Management strategies also put you at the center of your healthcare team. And we have a very complicated, barrier-filled healthcare system at times. Even if you're in one of the centers of excellence, there are still challenges that come up at times with coordination of care. And so thinking of yourself as you are at the center of that care, you are your advocate in helping direct some of that, and partnering with your providers to advocate with you if you are pursuing things like workplace accommodations or a new type of treatment or an insurance authorization. Directories and navigators are also available, again, through resources like the Cure HHT website. Ask about telemedicine. So again, since the COVID pandemic, telemedicine has become much more common, accessible, available. If fatigue, transportation is a barrier and you're not needing a physical exam for each of your appointments, the frequency of telemedicine appointments, particularly for things like mental health treatment, may be a reasonable option. Again, individual preferences apply. And then considering meeting with a rehabilitation or a health psychologist. If you are working with a rehab or a health psychologist, again, these are psychologists, mental health providers with specific training beyond the standard graduate training for clinical psychology or counseling psychology. They have expertise, particularly in working within the healthcare system, appreciating some of the barriers and challenges and unpredictability that comes with managing a chronic health condition. And they can help with the intersection of those mental health symptoms with HHT. So adjusting to a new diagnosis of oneself or a family member, maybe coping with that uncertainty. And there are evidence-based treatments for that coping with uncertainty. If you'd like to learn more about that, I put 2 links in here. One is to the Academy of Rehabilitation Psychology, which includes a directory of board-certified rehabilitation psychologists across the country, and then the Division of Rehabilitation Psychology. Neither of these are specific to HHT, and given that rehabilitation psychology is a very small discipline, I try to take the opportunity when I can to provide these links and educate. So with that, that is a broad overview of some of the considerations for mental health considerations in living with HHT. Many of these details also followed the workbook and the workbook that Dr. Sarah Palmer has published around self-management and living with HHT and living well with HHT. So I certainly can't take credit for the ideas here, but rather presenting it as a way of, for you in your current circumstances, what may be most helpful at this phase of your treatment and in your life. There's some references as well, including that living with HHT. One of many resources available, and it's a great go-to that has that psychological lens and mental health lens through this. So I know we did want some time for questions as well, so I tried to make sure we held some time for that as well, and glad to see we have a few more folks join over the course of the hour.
Thank you so much, Dr. Hughes. Really appreciate, as I said at the top, not only the time, but the comprehensiveness of that presentation. I hope everybody joining us live and those who will watch later sincerely found value in it. I'm sure you all did. As Dr. Hughes mentioned, Dr. Sarah Palmer's book, as she noted, is available on our website at curehht.org. If you head over to the store, you can find the book there, as well as some other new merchandise that has recently been added to help celebrate HHT awareness. So feel free to buy a shirt, wear it in your community. You never know what a conversation might provoke. I do see we have an attendee raising their hand. If you want to type your question into the Q&A box, we can get to it there as well. Dr. Hughes, while we're waiting on a few more questions, and I would implore everybody watching live to please do take advantage of this time. If you have a question, please leverage that Q&A box to type your question there. We'll get to as many as time allows. But I'm curious, a common refrain we'll hear from patients when conferences or speaking to them on the phone is that HHT can be kind of a killer of spontaneity given the chronic nose bleeding. It might be a reiteration of some of the points you've already made, but what tips or advice would you give a patient asking how to cope with some of that?
So spontaneity, right? It can mean different things to different people. So I might first ask, when you think of wanting to be spontaneous, what is the value? What is the image that comes to mind for you when you think about that? So to use one example, someone described it as, I just want to be able to walk out the door, or go out the door, go to the store, or go for a drive and not have to worry about XYZ happening. So again, from a psychology lens, we may look a little bit underneath that of what is it about that activity that is so valuable. And it may be that the spontaneity could be a part of it, and it could be the activity itself. So if you were able to do that activity without the spontaneity component to it, maybe that would still be pretty valuable, right? You could still get a lot of value from that activity, planning it and having all the value from that. Now, the spontaneity part, if that is also a really important piece of this, thinking about, are there other aspects of introducing spontaneity within maybe shorter distances or things within life that you have more management over? So if you do need to plan for a nosebleed, what resources do you need to keep with you in case that happens? We can't completely remove all the unpredictable aspects of it, but it's that balance of planning for the things we can plan for, and thinking about what are the actual risks, right? That if you do leave the home without certain resources, right? What are the potential risks within that, right? Sometimes it's a serious risk and sometimes it's a not so serious risk. So finding things you can be spontaneous with that are the lower risk activities.
Thank you so much for that answer. We did allow viewers to ask some questions in advance. I'm going to take a look at a few of those, but one topic I'm curious to get your perspective on, and maybe an overlooked area, not just in HHT care, but probably all rare disease care as well, is burden on caregivers. What tips, tricks would you offer for caregivers in the mental health burden for a spouse, a partner who might not have the chronic disease, but might care for somebody and deal with the ramifications of taking care of a patient?
Yeah, great question. And we see this across different conditions as well, in addition to HHT. Thinking about, depending on the nature of the relationship, if this is an intimate relationship, spouses or partners, sexual partners, etc., the role that the caregiving part takes on, thinking about a pie chart of before HHT or before that caregiving role, what were some of the things that you did together? And then as caregiving became a slice of that pie, thinking about how much of that pie is that taking up. And sometimes when we think of caregiver, when the word caregiver burden comes up, it comes from that lens of this idea that that slice of the pie becomes the whole pie. And so by the caregiver themselves working with their own mental health provider, having some time away, doing their own activities that are also important, and importantly, finding other activities that they do with their partner that are not healthcare oriented is a big part of that. So sometimes people will describe that my house has become like a hospital, or our bed is like if it's not an actual medical bed, it can feel like a medical bed at times. And so finding your space where you are still intimate partners together, or friends, right? You may go out to lunch and say, the rule for this lunch is we're not going to talk about my medical issues this time. Or next time, I want to make sure we have time to talk about the medical issues. So being clear about what you need, what your expectations are, and same for the caregiver as well. There are caregiver resources and opportunities for caregivers to connect with one another, to have their own space, and importantly, remembering that slice of the pie analogy can be really helpful for the caregiver part of it.
Really great answer. Thank you for that. We do have a question coming in the chat that I might break down into two parts here. Looks like we have a viewer who is dealing with loss, had a family member pass from HHT, and I'm very sorry for your loss. And kind of the two parts is, one, any coping mechanisms, strategies to dealing with the fear of death or mortality?
I'm so, is it OC, or I want to identify the person, but thank you for the person who did ask this question. We often do not talk enough about the experience of death and dying in the medical field. There's an avoidance around it, and there's a lot of fear around it, which I also saw in the question that was raised. And yet it's something that all of us will experience, right? Some of us sooner rather than later. And that experience of what is meaningful for you to make, what would your life look like if you could live the best life that you can, and what's important to you as you're considering living and dying. Sometimes things like hospice care is brought in at the very end of life. And there's often, especially with a condition like HHT, there's a large period of time where engaging a service called palliative care may be helpful to start thinking about what is important to me, what are my advanced directives. Under these circumstances, what types of interventions do I want? And importantly, what ones do I maybe not want? So that you can communicate, write them down, communicate to your family members what is valuable for you. It is scary. It's experienced as scary for many people. And a palliative care doctor and team, and sometimes psychology who's embedded within a palliative care team can help navigate some of those discussions. Again, knowing that on one hand, you may have the information of I'm declining, or my health is declining. Maybe you've even been given a prognosis of a timeline, although many doctors will not give the timeline for that. And you're thinking, where do I want to focus my life? What do I want to do to enjoy, while also navigating some of these big picture difficulties? Sometimes family members will step in and say, oh, don't talk about that. That's negative. You got to think positive. And while positive thinking has its role and has its place, having that space to talk about the value of your life and what a good death could look like for you is an important conversation. Even if it's not happening tomorrow, being able to have that autonomy to have that conversation is really key.
Really appreciate that answer. The second part of the question, and one that was honestly a common thread for some of the registration questions as well, as part of the patient experience can come a lot of anxiety leading up to appointments, whether it is follow-up scans to track treatment of a PAVM, or if a brain AVM might be growing, whatever it might be. And the individual who's asking questions live too asked about how to control nerves and anxiety leading up or going into those appointment scans, whatever it might be.
Great question. So when we feel anxious or fearful, it activates our sympathetic nervous system. So oftentimes we will start breathing more shallow. We may tense our muscles more. Our mind may start racing. So there are some behavioral indicators and some cognitive indicators too. So one thing that we can try to do is actually try to reverse some of those physiologic symptoms, beginning with the breath, grounding ourselves of where are my feet right now? Where is my body in this chair or in space right now? And taking in longer, deep breaths to recenter. It helps circulate oxygen. It helps us be less in that panic, low oxygen state going in. It doesn't change the situation that you don't know what that scan is going to say. But starting off with the physiologic symptoms can be one way of helping to manage that jittery, maybe tension and pain sometimes that comes with that tension. The other part can be thinking about if you're still going to the appointment, right? If you're not at a point where you're avoiding going to the appointment or avoiding making the appointments, anxiety is a pretty normal and common reaction to that. And the bravery comes from going to the appointment and facing it head on, being able to ask the questions and to advocate for yourself. And sometimes it can be also bringing someone with you to help distract, right? During the waiting room area. Let's go, this is where avoidance in a short period can actually be effective. Where you're in the waiting room, you're watching something, you're talking to a family member, getting yourself to the point where you can get the scan done. So then you have the information to then decide what happens next.
Absolutely. Thank you so much for those answers in the presentation. Before some closing remarks, Dr. Hughes, didn't know if you had any comments or closing remarks you'd like to make to our viewers today and the HHT community at large.
Again, I really appreciate the opportunity to meet with you all today. I know we just scratched the surface on some of the depth and personal experiences that each one of you likely experience in different ways. And I think those who shared some of that in the chat as well. Again, this is just meant to be a roadmap of where you may go next, and some of the strategies that you could then learn. As with any skill, our coping skills, they are skills to be learned as opposed to just talking about them. So the progress or the success that we may have in them comes from the daily progress of the skills, and working with a provider who helps you practice that on a daily basis, much like you would be doing a physical therapy exercise or other types of daily practice. It comes with practice, and it's not perfect, and it won't be perfect. So giving yourself that grace too.
so much. And once more, Dr. Hughes, we so greatly appreciate your time and expertise tonight for the session. Hope everybody watching found it valuable. I would like to close by saying this isn't the end of this conversation, it's the start of it. Here at Cure HHT, we are here for you in this community. We are your foundation. We are an email, a phone call away. Please do reach out. If you have any questions or concerns, we're here to help serve you and make your journey with this disease as navigable as possible and equip you with the knowledge, resources, and support you need to navigate it with confidence. You can shoot us an email at hhtinfo@curehht.org or head to curehht.org to find our phone number. We also have a resource library with several past webinars, resources that are organ specific. So please do check out those resources available to you. As I mentioned, June is HHT Awareness Month, so let's close out the month strong. Let's get loud and raise our voices to help continue to spread awareness about HHT. With that, I wish you all a good evening and thank you for attending our latest webinar. Take care.